Welcome to Beyond the Charts, a podcast series featuring Cira Monnig, founder of Lakeside Care Clinic. Each episode shares real stories and a fresh perspective on health and wellness, all rooted in compassionate, personalized care. At Lakeside Care Clinic, it's never just about the numbers, it's about going beyond the charts.
Hello, everyone. Welcome back to the LOZ Podcast Network. We have another edition of Beyond the Charts with Cira Monnig. And Cira, today we're going to talk about something a little crazy because, you know, you and I always talk about the clinic and everything going on there. But what we don't talk about is your history of all the things you've done up till now and what that's led you, the path that's led you down, and all the interesting things that you've done in the healthcare industry. And I think we forget a lot of times that you help people, you treat diseases. I mean, you help people with what's going on in their life. It's not just an urgent care, and it's not just a, you know, hey, I have strep throat today, but you really delve into some of the bigger issues with them. And a lot of that starts with your experience on the pulmonary side. Tell us, first of all, how did that come about, and when were you involved in pulmonary, and what did what does that kind of evolve to?
Oh, goodness. I spent about 4 years in pulmonary, starting, I think I transferred over there I did about 3 years in family practice in a rural health setting, clinic setting. And then I transferred to pulmonary in 2017 to about 2021 or 22, I think. 21, that's what it was. And so, yeah, I spent 4 years there. It was, probably one of the most amazing experiences that I've had, just in the sense of chronic disease process and really being able to just pull the whole body together.
And that was during COVID too, right? I mean, you were doing this when COVID was going on, and COVID with pulmonary was that was the center of it. So you were kind of in the middle of all that, weren't you?
I was. It is what led me to really getting out of the traditional healthcare setting and doing what I'm doing now. I was in the pulmonary through the height of COVID, and I followed up on all of the patients that had oxygen. If any patient came in and they got discharged with oxygen, whether it be from the hospital or the ER, then I would follow up with them for the next 2 weeks. I mean, pretty close to daily. I think it was every other day we were touching base with them, because the people that were on oxygen, typically the trend would be they would come in, they would be sick, they would have a little bit of oxygen, and about 2 weeks later is when they would crash. So we didn't know, okay, did they have COVID 2 weeks before they came in and now they're crashing, or are they going to crash in the next 2 weeks? So we kind of made a standard follow-up regimen based on the fact that we would just follow up every other day for 2 weeks, just telephone appointments or virtual appointments. But that was the last part of my experience in pulmonary. It was a very interesting time. But prior to that, I spent a lot of time just learning the different pulmonary disorders, the chronic disease processes, and really understanding how intertwined the lungs are with the heart and really the kidneys and every other part of your body. We saw a lot of COPD patients, whether it be from smoking induced or chemical induced or asthma induced. Pulmonary fibrosis was probably one of my little niches. I loved the pulmonary fibrosis patients. I would say that I was very empathetic with pulmonary fibrosis, probably more so than any of the other disease processes, just because we don't have a good treatment regimen for those patients, and it's heart-wrenching.
And the COPD it afflicts a lot of people. I mean, there's a lot of people out there, particularly, let's face it, smoking is definitely associated with that. Like you said, some of the chemical stuff. But it's prevalent, and there's a lot of people that deal with it. And I think particularly in the lake area and around the lake area, there's a lot of people that could benefit from your experience with that. And so, where they may feel like they have to go to the hospital or they have to talk to somebody, I mean, you have that experience. So, if you have any issues with COPD or something that's related, you handle that, right? And that's right in your wheelhouse.
I do. And I really kind of try to teach people to catch it early, catch the symptoms early so that you can get on the right medications early. You can prevent those exacerbations because that's how you maintain lung function long term. So most people think about COPD at the I'm going to say end stages, just simply because those are the people that are on oxygen and they're walking around huffing and puffing and they can't breathe. But you may be the patient that maybe you get a little bit short of breath walking up a hill. Maybe you just have this ongoing cough. Maybe you just have these respiratory infections that you get every year, twice a year. Those are the kind of things that really should be noticed and discussed more, especially if you have a smoking history or if you've had any kind of chemical exposure, or even if you grew up in a household where your parents smoked inside. Maybe you've never smoked a day in your life, but your entire childhood was indoors with the parents that smoked inside. You're still at risk for lung disease. So catching it early, being on the right medications and preventing those exacerbations, that's what's going to really help and improve your quality of life long term.
And is COPD something that you can treat and goes away, or is it something that once you have it, it's just managing?
It's just managing. So once you have it, it's there, and you manage it. And so that's why it's so important. I can't stress that enough. It's so important to really be proactive in acknowledging your symptoms, discussing with your healthcare professional, like what these symptoms are, what could this be, doing the appropriate testing to confirm is this COPD, and managing it from there to ensure that you don't have any exacerbations. It's when I say exacerbations, what is an exacerbation? It could be a lung infection. For that person that gets bronchitis, I just get bronchitis. Well, really, it's probably an exacerbation. And every time you have any kind of lung infection, whether it be bronchitis, whether it be an upper respiratory cold, you're worsening your lung function at that time. So that's it. So it really is important just staying on top of it and being proactive, because they do have a really good quality of life. COPD is not a death sentence. It is just time to say, hey, this is what I'm doing and this is what I'm going to do to manage it.
And then that's so important. I think the lung is one of those organs that when it's scarred, it's scarred. You're doing damage to it. It's irreparable. And, that's just closing down capillaries. And you're every time that you have something that affects you, whether it's bronchitis or something else, it's leaving its mark. And so you want to get a hold of it soon so that you're not getting, too much going on, because once enough of your lung is affected, that's when it's not a good deal.
Right. And I think that's where my job comes into play, to just educate. Sometimes patients, even if they're still smoking, they don't want to go see a provider because they say, oh, they're going to tell me to quit smoking.
Mm-hmm. Which you're gonna, but I'm
going to tell them that's probably what you need to do.
Right. But is it realistic?
You're a grown adult. Like, you make your own decision,
Yeah.
And so that is not something I'm going to harp on just because they know it. I know it. Everyone knows it. Quit smoking. But it is easier said than done. And I just let my patients know that when they're ready, come talk to me. If they feel like they need help to try to quit smoking, I'm more than happy to help them any way I can. We can talk about medications and alternative treatment remedies, like I think there's some ear piercing and acupuncture, things like that. I don't personally do that, but I do have resources that I send people to. So again, it's no different than in the wellness space. It's my job to educate as a healthcare provider. And that's exactly what I'm going to do in the pulmonary chronic disease processes as well. I'm going to educate, and we're going to work together to say, okay, where are you at? And let's meet you where you are.
Well, and I just heard the other day, and the stuff's coming out, but I've even heard some people that are utilizing some of the GLPs for smoking because they're utilizing it for people who are in drug addiction or have alcohol addiction, because it just like it takes away food noise, it takes away some of those cravings and some of those need that your brain has for, when you're let's face it, when you're hooked on something, I've even seen people that are moving towards some of that. I mean, there's so many new things out there to help people. And that's why people need to get a hold of you, because, it's not just the same old things that were done 10 years ago. But you have so much more knowledge now of what's going on. And you have so much knowledge in pulmonary and just in disease. I mean, let's talk about diabetes. You help people who are diabetics as well, right?
Yes, I do. So I treat diabetes, thyroid, pulmonary, asthma, hypertension, high cholesterol, all of those things that you would normally go see your typical primary care provider. I still treat all of those things. And we're going to talk about medications. We're going to talk about natural remedies. That's where I just am willing to sit down and go over the full spectrum of what is your idea for medical treatment and meet you where you are, but also discuss risk benefits of all the different options as well. So yeah, I do treat diabetes. The one thing, and this is what I tell people a lot, I know we've discussed in the past, insurance and how tricky it can be. Medications, I can typically get medications, dirt cheap. We're talking, for my members, most of my members pay $2 to $5 for a 90-day supply of most any medication.
That's amazing. I mean,
it's wild.
That's
the two categories of drugs that are very challenging to get at any kind of decent price are going to be insulin and pulmonary inhalers. However, the pharmaceutical companies will oftentimes do like a patient assistance program. They do, copay cards, things like that. They do discount programs for those people. I'm very familiar with working with those different programs and really maximizing my patients in the sense of getting it as cheap as I possibly can for them and making things affordable.
And you work with several pharmacies, so it's like you have a plethora of different choices out there. You'll go to one for one thing, one for another, but you've kind of assimilated this list of pharmacies that you can go to for different things, and that's going to help your clients as well.
Yes. There's so many resources out there for different things. The difference between some primary care providers, they may know it, but because they're so pressed to see so many patients in a day and they don't have time to see the patients, they can't even get around to discussing these options with the patients, right? And then let alone fill out more paperwork for the office. I mean, it's just more work, right? They're adding more work to their own plate. Not that they don't want to help their patients. It's they're overwhelmed. People in the traditional healthcare system, providers are overwhelmed. At direct primary care, because I'm able to do things differently, I am able to take the time with them, discuss all the options, follow through with the resources and chase those down and figure out, okay, how can I get this inhaler for this patient? And it's going to make it affordable for them. And so I'm able to navigate and go through those different options and fill out the paperwork that we need to fill out, really to just help the patient.
And I think people, sometimes, and let's face it might be in the name, care clinic, you think of clinic and you think I'm coming in for something I had today, I need it today, or I got a bruise, or I got I have something going on. But truly, it's direct primary care, and you can help people with their ongoing needs and what's going on with them, and you can manage that just like anybody else. And the nice part about it is, though, from my standpoint, is they get direct access to you, and they get to really get explanations on what's going on, where it's not like the doctor coming in for 5 minutes and then they talk to an assistant for another 30 minutes. They're spending time with you. They're spending time with Kat. They're spending time with true professionals who are going to really delve into what's going on. And if nothing else, you're going to provide them with all the opportunities that they're going to get anywhere, but they get it in this concierge service, which they can come in, they can get it the day of, they can come in and talk to you next week again if you need them. You guys are opening your doors to them whenever they need it.
Exactly. That is exactly our goal. And I mean, I know a lot of times people go into their healthcare provider and they hear, you need to lose weight, you need to exercise. But a lot of people don't even know where to start. A lot of patients just feel overwhelmed by hearing those words. They don't really want to take a medication, but they don't really know where to start with lifestyle changes. And I have the time to sit with them and help navigate that as well. So it may be 30 minutes of talking about, all right, we're going to count these calories. We're going to do this, amount of fat grams. We're going to do carbs and count all of it for those people and really provide the education to help them get started.
And to be successful. And that's the key.
Long term.
Thank you so much for another episode of Beyond the Charts. We learned so much from you, and each time we talk, I mean, it's just it's so intricate. And I think people get they almost get numb to it because it can be so much information. But you're able to break it down, make it simple, so we can understand it and we can get the help we need. And guys, I will tell you, if you need anything in the healthcare genre, you need to get to Lakeside Care Clinic. Go into the LOZ app under Health and Wellness, hit one button, you're talking to them. You probably, if you call them and it's, early in the day, you might get in the same day. And if not, you'll be in the next day. So that you're not going to find that kind of responsiveness at any place other than at Lakeside Care Clinic. So we appreciate what you guys are doing. We're looking forward to talking to you on the next episode of Beyond the Charts and delve into some more fun healthcare topics that all of us are interested in. And you're helping us learn and figure it out for ourselves.
I appreciate it and I enjoy it. Thanks,
All right.
Ken.
Thanks, Cira. And until the next episode of Beyond the Charts, it's Ken Lawler on the LOZ App Podcast Network. We'll see you soon.